today
Recording
6
in
years ago to
progress.
raise awareness that injuries are the #1 killer of people ages 1 to 44 years in the United States. This national effort, led by the Injury-Free Coalition for Kids, is backed by everyone here today and includes over 120 organizations who signed on to support NIPD. The actual day that most activities will take place is November 18th. On this day, join us as buildings, landmarks, and homes across the country light up green in support of injury prevention. Green is a color that reflects our shared goal of creating safer and healthier communities by improving local systems and promoting everyday safety practices. During that day, our NIPD partners will wear green, shine a green light, plan and implement injury prevention events, get city and state proclamations, and much, much more. There is still time to join the movement, learn more, and help spread awareness by adding your NIPD activities and resources at nationalinjurypreventionday.org. There you can find more information on the 30 Days of Action, the NIPD Toolkit, partner safety resources, and our Instagram chat live, which will take place at noon on 11/18. We are doing this in conjunction with Safe Kids, Safe States, and NDPA. Additionally, you can see about a fireside chat that we have, which is post NIPD. That will take place on November 20th at 2 p.m. and will be moderated by Tracy Meehan from Nationwide Children's Hospital. The panelists will discuss the importance of observances like NIPD in today's challenging times and reflect on the power of collaboration and partnerships in continuing to strengthen connections and impact throughout the years ahead. We're going to launch Get Ready for a Year of Action that will lead up to the 7th annual NIPD. A dedicated webpage, how-to guide, and reminders throughout the year will be featured on this new initiative powered by Safe Kids, T4CIP, the Injury Research Center at University of North Carolina, and Columbia University. As a reminder, if you post anything today or in the next few days to come, please use the hashtags BeInjuryFree and National Injury Prevention Day and tag Injury-Free Coalition for Kids. For today's webinar, we have a great panel on turning awareness into action, which will spotlight how advocacy and education save lives. Speakers will talk about policy change, drowning prevention, e-bike injury risk, firearm safety, and child passenger safety. I would now like to introduce the moderator, Sue Prentice. She's a paramedic and state senator, as well as the executive director of the American Trauma Society. She's held leadership positions in healthcare, public safety at the national, state, regional, and local levels. She was New Hampshire's first female chief of EMS at the Department of Safety. She served 6 terms as Lebanon City Councilor, completed 2 terms as mayor of her city, and is currently serving her 3rd term as the New Hampshire senator. The U.S. Department of Transportation Secretary Buttigieg appointed Sue to the National EMS Advisory Council in October 2021. Please join me in welcoming our moderator, Sue Prentice.
Thank you, Dr. Pomerantz, and thank you everyone for joining us today. Our incredible panel that we have here, as well as participants. We're here. We have this incredibly distinguished, activist, parent, and leadership group here to talk about how you can be part of unifying a voice and using your awareness and the awareness that you're going to gain today, and how our panelists have used their awareness in their areas of injury prevention and brought them to action. As Dr. Pomerantz said, I've had the opportunity to serve in different roles, in different policy roles in my, working as the executive director of the American Trauma Society, but also as a policymaker, a citizen legislator. And I've used that's my everyone's going to talk about their superpower to bring the things that are important to me, including, and most importantly, preventing injuries to our state, through our state Senate, to talk to everybody about how we can prevent motor vehicle crashes, how we can make children safer in schools, how we can prevent drowning. There are all different ways that we engage our superpowers and unify our voices. So without further ado, I want to introduce our panel, and then we're going to do a little round robin to get started, and we have some questions. So first, I'm going to introduce Chazak Sunanda. And Chazak is the founder of No More Under. and she's also a filmmaker. She's an advocate, a not-for-profit founder, and a change maker dedicated to advocating equity in water safety. After losing her son to drowning, she founded No More Under to expand access to swimming lessons, champion systemic change, and push for legislation in Washington state that ensures awareness around water safety and drowning prevention. These are just little snippets of this just incredible, her incredible background and others that are other panelists that are here today. Joe Colella is a child passenger. He is the director of child passenger safety for the Baby Safe Alliance, bringing over 30 years of experience as an advocate, an instructor, and an industry expert. He's certified as a child passenger safety technician instructor and leads the Alliance work on car seat safety, education, and regulatory engagement. He's trained professionals in 48 states. I hope you've been training professionals here in New Hampshire, because I know we have a number of really active folks in child passenger safety. Sharon Gilmartin. I've known Sharon for a while. She's the executive director of the Safe States Alliance. She's a dedicated public health professional with a strong background in organizational management and supports upstream public health initiatives. She's passionate about improving health outcomes through data-driven strategies, cross-sector collaboration, and partner engagement. Skilled in navigating the federal funding landscape, which is a really important conversation right now, to secure resources, develop efforts, and support a team to enhance workforce capacity and advocate for policy change on our prevention efforts. Justin Asowan, and we're just going to call him Justin. He is a physician, pediatric emergency medicine physician dedicated to advocacy and injury prevention. He's deeply involved in community initiatives focused on child safety, leads an effort to promote helmet use, expanding access to helmets for underserved families, and advances local water safety education, and collaborates with multiple school districts to implement e-bike safety curriculum for middle and high school students. Shannon Klug, okay, and she's a colonel, served over 24 years in the U.S. Air Force as a weather officer. She's a gun owner, a mother of three children, and has been actively involved in gun violence prevention since 2018. She's involved in Every Town for Gun Safety and Be Smart, which asks gun owners and non-gun owners alike to take simple steps to reduce unintentional shootings, suicides, and homicides that occur when teens or children gain access to guns that are not properly secured. And we have our leader today bringing us into this discussion is Dr. Pomerantz. And as she introduced herself, working as a pediatric emergency physician. Dr. Pomerantz, thank you for bringing up the memory so we can honor Lenita Johnson, who has just been, such an incredible force in bringing us to where we are today. And I'm just so fond of Lenita. So thanks for everybody. As we went through our introductions, you can see how all of our panelists have cross background in talking about gun violence prevention, public health initiatives, drowning and water safety prevention. And I'm really interested in all of these, but to hear a little bit more about Justin's work with micromobility, I think it's just such a key issue for all of us across the country right now. So the first thing I want to do is just do a quick round robin. I'm going to call you out one by one and share with everybody here today that's listening in and participating, what brought you to your work? And I'm going to start with Joe.
Yeah, I started my work in child passenger safety 31 years ago, and it was the hard way. My sister was in a crash, and 3 of her kids were with her, and her 3-year-old daughter didn't make it, and it was because of a compatibility issue with the car and the car seats, and so I got involved to help prevent that from happening to other families.
Okay. Great. Thank you for sharing. I'm sorry to hear of your family's loss. Thank you for sharing what has brought you to this work. And, I just want to share back with you something in the last few years that I've been involved in my state, which you would think would be simple, is legislating to make sure that children of a certain age and size are rear facing up until they're prepared to be turned in the other direction. And that's not always an easy message. And I'm sure that you have worked with this. So maybe we have an opportunity to tap into this later. Thank you
Yeah,
so much,
absolutely.
Joe.
And I,
Let's, I'm going to come over to Shannon. Should I call you Colonel?
No, that's not necessary. I'll go by Shannon.
Okay.
So I served 24 years in the Air Force, and that's where I learned how to handle the firearm. And as you mentioned, I have 3 children. And when I retired, and actually this started before I retired, you hear about the school shootings, and as a mother, it's terrifying. It was terrifying for my children growing up. And so I started really looking to figure out what could I do. And veterans are respected for their service, and I felt like I needed to be able to use my voice as a veteran in the arena of gun violence prevention, and use some of my expertise to help other parents learn how to keep their children safe.
Great. Thanks, Shannon, for sharing that. I mean, all, one of the most important roles I think I've ever had. I might have a lot of titles, but one of my most important roles has been a parent and a mom, and working to keep my Phoebe safe when she was in our home. She's 28 years old now, but I feel like we, as we're here today, we all have a responsibility, and that's why we're here to share our messages and work to keep all children safe. So it's going to be really interesting to hear some of the work that you've done around firearm violence prevention. Thank you so much, Shannon. I want to hear from Chazek. I want to hear from all of you, but I'm going to go to Chazek.
Hi there. Thank you. And just grateful to be here with all of you and your panelists. So very similarly to Joe, my work has started because of a loss. My son, Yori, was 3 years old when he drowned 7 years ago now. And so just realizing the lack of information, the lack of access really got me started. And yeah, we're kind of tapping towards a national model now. So we're really excited about our growth and just wanting to make as much impact as possible.
Okay, great. Chazek, thank you so much. I want to share with you now, and we'll probably talk a little bit more about it when we get more into your work. And like Joe, thank you for sharing your personal story. It's what brings you, not only it brings you to your work, and it's going to impact as already has the lives of others. In my little corner of this world, one of the things that we've done in injury prevention in the state of New Hampshire is we noticed we had a number of drownings drownings or near drownings in rivers. We have beautiful white mountains and rivers and streams, and sometimes these things can get away from us. So we've been funding and working with these life vest stations along the public access points that folks go with their children, adults and children, to go and swim when they're hot. So I wanted to share that with you. And I want to just remind everyone, I mean, we've talked so far, we've heard from Joe and from Shannon and Chazek, that if you have a question, pop it in the chat, and Delaney's going to be shooting those through so that I can, it's going to be moving those through to me so that I can make sure that we get those asked. Great. So I'm going to go over to Justin. What brings you to your work?
Yeah, good morning, everyone. Thanks for having me. And thank you for that introduction. I am now an emergency physician, sort of junior faculty, and I grew up in Southern California in San Diego, where I did my fellowship training and currently working. And I grew up as the stereotypical surfer, skater, snowboarder of Southern California. I was I guess you can call it the dumb teen who didn't always wear their helmet. Luckily, I didn't have any specific injuries, but I know many family and friends who did have a traumatic brain injury, traumatic head injury, or other sustained injuries. And now being on the physician side, working in the emergency department and seeing these injuries, it was an easy sort of niche for me to fill in and really spread that awareness, start working to provide helmets, talk about the importance, start talking about policy change. In an area that I grew up in and sort of continue to participate in. I still skate almost every day. I surf every day. And so it's really an area that is of interest to me, easy for me to work in and try to keep kids safe.
Okay, thanks so much, Justin. Just a quick question for you, because we are in the Trauma Prevention Coalition and the community that surrounds that are talking a lot about right now about micromobility. And I think part of what brings you to our discussion today is seeing this uptick in injuries. And so have you seen helmets already start to impact that?
Absolutely. Yes.
Preventing injuries. Sorry, go ahead.
Yeah. Yeah. Like you said, micromobility, primarily e-bikes, e-scooters. E-bikes predominantly have taken off in the last 4-ish years or so. I think in our emergency department in 2019, sort of the pre-COVID era, we saw maybe 3 total e-bike injuries. This year we haven't even closed out the year. We're over 200 injuries that meet trauma criteria. So we're seeing way more that don't necessarily meet the trauma criteria, but over 200 from 3 within 4 years that are injuries so severe that, the trauma surgeon also gets involved in our initial assessment of the patient. So helmets make a huge difference in helping reduce those injuries, and head injuries are some of the most common injuries that we are seeing with e-bike related or micromobility related accidents.
Thank you for sharing that really on the ground perspective. It is a growing field, and the discussion, the voices around more education leading us to prevention. I think, well, what I know, I hear it all of the time, are only going to continue to grow until we can wrap ourselves around some policy changes and more awareness. And and this is part of what brings me here, and I'm going to lean over to Sharon at Safe States, is pre-COVID, because you talked pre-COVID, post-COVID. I was at a Safe States conference in Atlanta. And I remember, and this was in the very early days of micromobility. And I remember I had crossed the street and safely in the crosswalk. And as I turned around to come back to the hotel where the conference was, I saw these 2 women in flip-flops on e-scooters with their pocketbooks and no helmets, just whizzing down the street. And, the perspective that we're all coming from, whether we're talking about water safety or we're talking about micromobility, or talking about child passenger safety or firearm safety, is this lens leads us to looking at situations and thinking, I know how to prevent something from happening here, as well as, oh no, something might happen here. And that's how I felt that day. We're in a much better position now. I want to hear from our friend Sharon Gilmartin at Safe States, and then I have some questions for each of you. What brings you to your work at Safe States?
Well, you have me laughing, Sue, because I have actually brokered a deal with the children in my neighborhood about wearing helmets, because many of their families don't feel strongly, don't enforce that. And it's something I obviously do feel very strongly about. So we sort of have a candy situation, wear a helmet, come by my house. It's a great situation there. What brought me here? Well, I will say, fortunately, I didn't have a personal experience that brought me to injury prevention. I fell into it. I was in my 20s. I needed a job. I got connected with this amazing training program out of the UNC Injury Prevention Research Center that was training public health practitioners about the fundamentals of public health and how that applies. And there were various outcomes tied to that. And it turns out that I was my own best student at that point, because I really, it really just sparked for me about just how predictable and preventable all of these various outcomes are, and the systems aspect of it. It spoke to me then, and 2 decades later, it's still speaking to me. And you see it everywhere. We see in every facet of our life, we see injury topics, and we also see the systems that affect these injuries. And I feel so strongly that we can make a difference in this work, and we are making a difference in this work, and that's what brings me back every day.
Thanks so much, Sharon. And I've already shared, that's my story about the Safe States conference, but each one of you have brought to light already by talking about the passion that brings you to your work, why your voices and everyone's voices are so important. And as I get into the questions, I just want to say something as, whether I'm served as a local legislator or now in the state Senate, the families that come, the moms, the dads, and even the children that come and sit before us and bring their voice to issues. And I spend a lot of time in that, talking about healthcare and prevention issues. They really make a difference, especially for the other policymakers that don't have the kind of background that I do. Those voices are very powerful, enlightening, and educating. Keep that in mind, which is a perfect segue into Chazak. I want to talk to you. Can you share with us Yori's Law that you helped define and get passed in Washington State for water safety education. Can you walk us through how you were able to bring this about? And I want to applaud your work as we lead into this part of the discussion.
Thank you so much. And yeah, I really believe that policy is such a strong way because you're impacting so many. The trick is just getting in the door, right? And so we were really fortunate to have a connection with a local legislator and representative and our local representative. And really, she was willing to work with us and figure out just a something, right, to make a difference, because it's really challenging, as we all know, to get the exact law that we really want. And so you just need to see what feels passable, and also what feels, I don't know the best word, but basically just that will make the impact. And so luckily we were able to work with our local legislator to come up with Water Safety Day. We looked at other states and what was passed, as well as what wasn't passed. And so we kind of were able to look and see. And so it was honestly interesting because it ended up being a law. Originally, we weren't even going for a law, but for whatever reason here in Washington State, that needed to be as such. And so May 15th, which is also International Water Safety Day, became our Washington State Water Safety Day. And honestly, it's truly a baby step, right? It's brought some awareness. We reach out to schools every year. We do all of the things in having a local Water Safety Day impact, but we're now trying to climb or just add on to basically that law into getting some things in schools, right? So it's like you have to get in and get the initial kind of awareness going and people championing what you would like. And then now we're going back and trying to ask for more. So I'm not sure if that was exactly helpful, but
it is very helpful. And I want to speak to just the perspective of your voice and bringing it to the legislature. These are just regular folks, okay? Like, I'm a paramedic. I used to sit in a city council next to an apple farmer on one side of me and a real estate agent on the other side. And my point is, they are accessible. They want to hear from the public, and we are there, to solve problems. And here by solving problems, we're making it a safer state, a safer world for our kids. And so Chazik's example of how she took her voice, her personal story and tragedy, and put that to work for children and families throughout her state, that's possible for all of you. And I really thank you we're going to talk a little bit more, but that was really super helpful, which brings me, I want to pop over to Joe and talk about child passenger safety. Joe, can you share with us through the Baby Safe Alliance policies, regulations? It sounds so, but policies and regulations are really important to, as I talked about, getting that rear facing, law in place was a big deal. What have you been involved in with the Baby Safe Alliance to help improve safety standards and reduce what we know are preventable injuries in children?
Yeah, absolutely. And, some of the policies are like you just passed in your state, where I had the privilege of testifying to the Transportation Committee on that, on the importance of having a good law that is an educational tool, not just an enforcement tool, an educational tool. And those laws are. But on the regulatory side, we're in the midst right now of a big change in car seats. We have 3 regulations that are going into effect. They began to go into effect June 30th of this year, and will continue through December 5th of next year. And that's making car seats safer. And the Baby Safety Alliance is a large portion of our membership is the manufacturers that make car seats. And they know a lot about car seats, and they know a lot about the performance, the outcomes as a result of them, of using them correctly or incorrectly. And so they're able to participate in that regulatory process in regular dialogue with the regulator, the National Highway Traffic Safety Administration, to help create regulations that make the most sense for child safety. So it's a wonderful place to be. On the policies that need attention now, those are already going into place, and we need to work on those first before we add more. We need to perfect the ones that are going into place. But the policies that need attention now are really state laws.
Yeah.
If you've got conflicting voices where you've got advocates telling you kids need to ride rear facing longer, they need to ride rear facing till they're 2 or until they exceed the limits of a car seat. But you've got the state law that says you can turn your child around at age 1 or without putting an age there at all. Parents are going to listen to, a lot of times, parents are going to listen to the voice of those many different conflicting messages that they already agree with. It's just reinforcement of what they wanted to do anyway. So if the laws and the laws of physics are closer together, the state laws and the laws of physics are closer together, then we're going to be in a better place. And it's not just passing a law. The laws have to be active and visibly enforced as well. And that involves training police officers. If you ask a large group of police officers right now what their state's child passenger safety law is and how to enforce it, they may come up with several different answers depending on which one of them you ask. So having the training to adequately function in that enforcement capacity and refer people to educational programs in their area is an important part of it. It's an important part of passing a law, is having it visible to the community and having it understood by the law enforcement officers.
Okay. Thanks so much, Joe. Part of what I hear you saying, and Jessica has her hand, I think you might have a question or something to add on, but part of what I hear you say, like, thank you. First of all, thank you for coming and testifying. I wasn't on transportation then, but I am actually on transportation now. In all of our states, the leading cause of death for, youth, young adults, somewhere running from 34 to 44, it's injury. And we know that motor vehicle crashes are, a primary mechanism behind, unfortunately, fatalities. So, but part of I think what I hear you saying is that there are, that parents, even if legislators don't move to put laws in place, that parents are listening to this conversation, this policy conversation, and making changes in their own behavior. So it isn't laws, they add to a level of enforcement, but at the same time, having that policy discussion is educating everybody. Okay, so we're going to come back to you. I want to tap to Chazik quick, and then I'm going to come down to Justin for a question. Chazik.
Thank you. It's very quick. I just wanted to add on, Joe, you're completely right that passing a law does nothing. And it's really important to figure out funding around all of this stuff, right? They can say we're doing X, Y, and Z, but unless you have funding, we have the National Action Water Safety Plan, and we need funding to implement all of these things. So it's really important as you go after your legislator or policies that there's funding to implement the training and all of the things that you need along with that. Thank you for the moment. I just wanted to add that. It feels very important.
It's a great moment. And as we move over to Justin, when you come to any policy body, that's going to legislate, and especially when you're asking to solve a problem and it involves funding, if you can bring the solution with you, and that usually involves bringing stakeholders together and try to find a funding mechanism as you make your request, that's very powerful. One of the key things, and I know Sharon Gilmartin does a lot of work at the federal level, but also Safe States Alliance is well connected with all the state level legislatures as well. Let us never underestimate the power of state legislatures in pulling policy levers that change lives every day. Because we've already talked about Washington State, we have a New Hampshire example, and now we're going to talk a little bit about, what's happening in Justin's world. And I want to pop over, and you, in your introduction, you talked about not only what brought you to this work, but seeing this uptick in in injuries from pre-COVID to now that's substantial and has really had a lot of attention and is getting it in the trauma prevention community. What changes do you think, or are you thinking about in policy and public education, or even product design that are essential for reducing injuries in this area?
There's a lot. This is all so new, and it's such a new sort of what I call kind of an epidemic in the world of injury prevention. I think in terms of policy, there's a lot. This is a very hot topic right now. There's a lot of legislators talking about what type of policy that they want to implement to put restrictions or change infrastructure in order to support these micromobility modalities. And one example is recently in one of the cities here in San Diego County just put in a bill that essentially makes it illegal for 12-year-olds and younger to ride e-bikes. They would be fined up to 2 times, and then the e-bike can be compounded and taken away. And the family would then have to pay another fee to get that, recovered. And so that's sort of, there's a lot of different policies, and that's just one city in San Diego County that has implemented this. And we anticipate more of these cities throughout San Diego County and throughout Southern California, and then spreading outward to start adopting some of these policies. But from a product standpoint, what's actually quite interesting, what I learned over the last year or two, is these e-bikes, whether it's class 1, 2, or 3, and there's different things that changes their classification, but ultimately it's the speed that really we see that relates to more severe injuries, to no surprise. So class 1 and 2 with a max of 20 miles per hour, class 3 with a max of 28 miles per hour. Many of these kids can modify that and modify the products of the e-bike so that the e-bike is not actually registering the top speed of the e-bike, and it doesn't automatically shut off at 20 or 28 miles per hour anymore. And for instance, a class 3 can now reach 60 miles per hour, 70 miles per hour. So you have a 16-year-old on an e-bike traveling 60 miles per hour on a busy street, blowing through through lights and cross stops. And the changes are quite easy. If you actually go on to YouTube and Google how to modify an e-bike or how to prevent top speed, a 30-second video, any teenager could put a magnet on a battery and it doesn't record or a sensor, and it doesn't record that top speed anymore. So these modifications are not difficult to make. And so from a policy standpoint, it's one thing to implement this policy, but from a product standpoint, I think one of the next steps that we're going to work on, or is one of my sort of projects in the future, is to talk to some of these bike manufacturers and how do we make it a little more difficult to modify the bike in order not, so that it doesn't just take a magnet to prevent that top speed from being achieved.
Justin, so you're in a city setting. I live, say, more rural New Hampshire, but I want you to know the problem is exactly the same here. Maybe the numbers are less, but I live right off of a main road in a place I live right by Dartmouth College in West Lebanon, New Hampshire, and not a day goes by where I don't see either an adult or a child zipping down this road. Some of them have helmets on, some of them don't, but it's clear to me that we have to have more conversation here from a transportation perspective on how to respect the e-bike owners, but at the same time, bring more safety to their world and everyone around them. Do you have any model policies or practices, something that folks who are listening in today could contact you for?
Yeah, absolutely. We actually just, so one of the biggest things that we worked on this over the last several months was an e-bike curriculum, essentially, that we are distributing to the local high school districts and middle school districts, totally free on our website. And it takes students through, I think it's a 7 to 8 module curriculum on familiarizing themselves with their bikes capabilities, the safety of the roads, the rules of the road, but then also what to do when they do encounter an accident and how to sort of activate emergency services. And what we're trying to do is work with the school districts in order to make their students go through this curriculum. And it doesn't take long, an hour, 2 hours max if you're really taking your time through it, and print out a certificate at the end to sort of earn a parking pass so that the students can then, legally, or at least meet the criteria to park their bikes on campus.
Thanks so much. So if folks want to, I'm going to just, first of all, I'm going to remind everybody in the audience today that if you have a question, please put it in the chat. I just want to pop up to Delaney and say, how would folks who are listening today who want to contact Justin to learn more about this curriculum, because they're, we're facing this in every state and every community. How would they contact Justin?
Hi, everyone. Thank you, Justin, for that information. And there is actually a few questions on the Q&A regarding e-bikes, including the recommended helmets that are available. So if you can take a look and answer, that would be great. Or when it's time for Q&A, you can definitely email me at dr146@columbia.edu or info@injuryfree.org. And I can certainly put you in contact with Justin and his incredible curriculum.
Great. Thanks, Delaney. I just popped the Q&A. So thanks, folks who've put messages in there. We're coming to you. But first, so thanks, Justin. I want to come over to Shannon, and it's really timely to be able to talk to you today as a veteran, where yesterday was Veterans Day. I want to thank you. We all want to thank you for your service. But, this leads me into a question about how has your work in the military really influenced your thinking around your advocacy and the work that you're doing in the area of firearm violence prevention, and in safe storage, Be Smart. Can you share how this informs your advocacy work?
I'd love to. So, in the military, we really learned that the three pillars of firearm ownership or usage is training, safety, and accountability. You don't touch a firearm until you're trained, you know how to operate it safely, and you are very accountable. We were disciplined counting bullets, when we were deployed. So it's very serious, and it's taken very seriously. And so I really have taken that, and I feel like we can translate that back to the civilian world, and gun owners and parents need to understand and maintain that level of training, safety, and accountability. And so that's what I really feel is great about Be Smart. And, I'd like to pivot. We've heard a lot of top policy talk here today, but what we're trying to do with Be Smart is, I think, more cultural change, right? So really teaching adults, caregivers, parents, and, caregivers could be grandparents or daycare providers or teachers, any trusted adult that our child is coming in contact with, really about firearm safety and secure storage. So simple things like securing, guns in homes and in cars, because firearms have become the leading cause of death for children in the United States. In 2023, firearms surpassed car accidents. It surpasses cancer. And that's something that's really completely preventable, right? So it's really imperative that parents, adults are keeping access to guns away from children. They don't need access. And so we really teach parents how they can do that, the right way to store a gun, the different ways to store guns with different types of locks, and choosing your method of storage based on your child. So a simple cable lock would be, sufficient for a young child, not a teenager. With a teenager, you really need to think about a lockbox, something with maybe like a fingerprint access or a code that only you have. They found that 76% of the guns that walk through the door of a school have really come from the home of that child or the home of a relative or friend. So it's, once again, imperative for the adults to be securing those firearms so that children don't have access to them.
Thanks so much, Shannon. And I don't know in your work, but I would imagine, or it wouldn't be a surprise to me if there are conversations that come up, not to hit the third rail here, but to quickly just talk about the Second Amendment. Sometimes when we start talking about these really important issues around firearm injury, firearm violence prevention, there are some, being a legislator, I know this conversation pretty well. I don't know if you come up against this, but I do, want to share with people that the Second Amendment and firearm safety can coexist, and they do coexist. And a perfect example of that in like pivoting, taking Be Smart and just drawing it out a little further here is the Gun Shop Project. And it's not just a New Hampshire project, it's happening throughout the country where owners of gun shops are partnering with injury and violence prevention professionals to have materials in their store about suicide prevention, about firearm safety, concerns about, potentially, homicidal type of behavior. They train their staff that are selling firearms. They have an awareness and they're able to like lean into these potential situations when they come their way. So these two things can coexist in the space of talking about firearm safety every single day. So I just wanted to bring that up. And Shannon, thank you so much. And I'm going to come over to Sharon, not Shannon, but Sharon Gilmartin before we get into Q&A. And Sharon, can you give some advice to everybody? And, I think most people here that are on this panel could do this, but I want you to shape this final part of the conversation today about how as you're preparing, how folks could prepare to go and talk to someone, I consider easy like myself about making changes in policy at the state and at the federal level. What's your advice?
Yeah, the underlying all of this is patience and persistence. And if I can emphasize one thing, it's that it doesn't have to be that hard. Okay. Think about what you have, what you know. Advocacy can feel really intimidating, but it's really just actually about connecting your expertise to a shared goal. You are the expert. Shazak was the expert in what she experienced in her life, and that was what made her such a powerful advocate for Uri's Law. You don't have to be trying to do all things with all people. Think about who else then are part of your circle and other resources that are available to you. Once you're ready to get involved, you can think about, are you a part of a community coalition that you could engage? Could you build a coalition? Do you have other partners working in this space, or are there relationships you might want to build? There is definitely strength in showing that diverse partners, whether that's health departments or nonprofits or advocates or survivors, are united around a common message. And that can really take a priority to the next level. One of the other things I would say, and I think you're sort of touching on this when you're talking about the Second Amendment and all of these other things, is that we have to focus in on the fact that safety is nonpartisan. It is not political. Our goal is to let our children thrive. Our goal is to have our families and our communities feel like safe spaces where everybody can live up to their maximum potential. And so we have to be able to tune out the noise a little bit of the things that take away from that. And as people introduce rhetoric, don't get swayed by that. I would also encourage people just to think a little bit long term. Policy change isn't always a sprint. In the movies, maybe it looks like that, right? But really, it's a marathon, and it can be a relationship marathon. And just that patience and persistence key. You'll probably be tired of me saying that, but you have to be prepared to educate policymakers repeatedly. Sue, you can probably attest to this. Policymakers are flooded with information and asks day in and day out. Our director of government relations at Safe States will tell you, you're not being a nag, you have to follow up so many times. It's going to feel weird to you, but if you don't continue to show up, it's going to be too easy to dismiss your cause. So just share, again, what you're an expert in and speak in plain English if you can. Even if you are an expert and the data feel really compelling, tell those stories, make it relatable, speak in words that everybody can understand so they're really understanding what you're trying to accomplish. I will say, and I can put it in the chat, we do have a number of advocacy resources available both on the Safe States website and Keep America Safe, which is a campaign that Safe States has been leading to support federal investments into injury and violence prevention, specifically through the CDC Injury Center. So I'll pop those in the chat if that's okay, Sue, because we have tools and resources. You don't have to start from scratch. And the final plug here is, back to it being a marathon and not a sprint. Celebrate those wins along the way. It can be long and it can, feel at times like, I'm not making much progress and you lose momentum. So really focus in on those little moments, those little wins along the way, because it's making a difference and, it's once you look back retrospectively, that's when you can really see that your work is mattering.
Thanks so much, Sharon. The first two things that Sharon, the first two P's that Sharon brought up were patience and persistence. And it's really true. Like I remember, my early days in, doing policy work, whether it was in the city that I lived in or on the state legislature. And I'd have a problem that I wanted to solve. And I'd be like, I got to get this done. And it felt like, it felt like the marathon had already started. And I remember this legislator who used to sit behind me, who's now retired. And he said to me, Sue, sometimes this takes years. Do not be discouraged. If it's important to you, then continue the work. So you have to be patient, okay? And if you're persistent, all of you, I'm not talking about me, you will get this work done. So that is really, that's really sage advice as you enter this arena. We're going to move to a little Q&A, but I think another thing, you've all touched on this in some way, and I'm so grateful for it. But Sharon did a nice job of it's kind of like when you pull the thread through, is that your personal stories, everyone that's on this panel, as well as those who are listening in today, your personal stories, and bringing those to your city council, bringing those to your county government, bringing those to a state legislature, wherever you're turning your awareness into action, those stories are so, you make them relatable. And that's, as I brought up early on, we want to hear from you. But at the, that's number one, is bring those stories, you make them relatable, and speak in a language that you can be technical, but you got to talk again, and not being disrespectful. An apple farmer, like the greatest guy, but he'd lean over to me on the city council and say, I don't understand what this hospital is talking about. And I'd say, well, and it was the difference between, something like urgent and emergent and emergency. That was not his area of expertise, but mine, but he taught me to distill it down in a way that everybody can understand. So keep that in mind moving forward. Boy, these are just, thank you all for your great, your answering bringing your perspective, answering my questions, and sharing in the round robin what brought you to your work. Let's see, we've got a couple of minutes to get to some questions here. And if you look in the Q&A, some folks have added data and resources. They're not necessarily questions or answers. So I don't want to, set anything aside. I just want to bring that up. And I see my friend Paige is out there, Paige Colburn Hargis. Hey, Paige, how you doing? So I talked about the gun shop project, and if you're looking for any information, there's a question about where do I get information or curriculum or education materials for gun shops or around gun safety. Just Google it. Thank God for Google, the Gun Shop Project, and you're going to find a lot of information that is there. I saw a question in here, and I think, Justin, you've already answered or provided some information on some e-bike safety, because it said in the little thing, Justin is answering this. So let's see, where was that other
Rebecca Melvin from Jacksonville also provided some information with regards to the helmets, that not all MIPS helmets are designed for higher speed e-bikes. Provided some rating of helmets that are at least rated for up to 28 miles per hour, which is good to know because they have a lot of problems out there in Jacksonville, and she's probably seen them all. And they are marked as electric bikes, but as you dive into their website, they are actually electronic motorcycles, which even an NTA helmet wouldn't provide much protection. So beware and be careful. If you need more information or you want to talk to Rebecca, you can email me at info@injuryfree.org, and I can put you in contact with her. Pretty sure Justin would also know this information.
Great. Thank you, Delaney. So I see that I think Asita has put in a number of, really informative posts and resources for folks. But in her very first, she talks about a call to action. And I just want to read this quickly. As injury prevention specialists, it's important that we standardize language. It's how we establish consensus and position ourselves as a united front for everything from data collection to regulation and legislative action. That sums up so beautifully why we're here. And all of you have spoken to this in one way or another as panelists today. And hopefully I'm pronouncing your name correctly, but thank you for all of your resources, and just that opening in your call to action is so important. Let's see, for Joe, a great tool is that 20% of the states have already obtained law enforcement training credit in car seat basics for law enforcement. Joe, do you have anything? So you had mentioned it. Danielle has responded to it. Anything you want to add there?
It's a great piece of input. Thank you, Danielle. What it brings to my mind is that is specific to law enforcement, educational tools for law enforcement. There needs to be resources like that for each audience. So as an example, kids don't come with safety instructions. So the Baby Safety Alliance, as an example, my organization came up with something we call Baby Safety 101. And it's something that's optimized for reading on a cell phone. And it talks about car seat safety, sleep safety, household safety, and other areas that parents don't necessarily find on their own. So that's another resource. Safe states and safe kids have tremendous resources and links to those on their websites, but they need to be appropriate for the audience. And thanks, Danielle, for pointing out the one that's very appropriate for law enforcement officers.
Great. Thanks so much, Joe. I want to Delaney, in talking with, or Rebecca Melvin, talking about helmets, the rating of helmets, and that she brings up a specific type of rating that's marked for electric bikes. And Justin, do you have any input on this? And Jessica, I do see your hand up. Hang on just a second. Justin, any input on that? Any particular safety ratings?
There's still a lot of research being done on this in terms of helmets for e-bike specific, but what's out right now is a rating that's NTA 8776, I believe. And that's what we're currently recommending for at least class 1 and class 2 e-bikes, because it'll cover the speeds that those two e-bikes meet, assuming that the e-bike has not been modified to increase their factory speeds. But once you start getting into more higher speeds, really the only helmet that's going to truly be safe, especially once you start exceeding 28 miles per hour, is a motorcycle helmet, because that's really the only helmet that's been tested at much higher speeds, which we are seeing electric motorcycles or zero emission motorcycles now as well, and kids on those. So it really depends on the bike, the top speed that the bike is reaching. A standard bike helmet or a standard, multi-purpose or skateboard helmet would not be as protective as at least a NTA 8776.
Great. Highly technical. Thank you so much. This is information that is, some of this is new to me, and that is, I think, a great resource for folks as we continue to manage this e-bike and micromobility, again, prevention work throughout this country, but many of you are handling it on a state and local level. But we know, as Justin's been able to summarize, and it's something what you think you know and you can prove. We know, and we think, and we're at the point of proving how these injuries are impacting our communities, and we can make them safer through some cultural changes and through some policy changes. Now, as I go to Chazik, Shannon, if you can take a look at Jenna Gibbs has a question about thoughts on gun stories. If you could just take a look at that, and because I'm going to go to you last, I know we're running in time. We have a video to show, but Chazik.
I'll be very short. I just wanted to pop back into Acacia's comment, and she's an amazing, researcher in water safety, and I think just in general. But I just wanted to kind of stress that I feel like it's really important to do both things. For example, the coding that needs to happen so that water, drownings are reported in a way so that we do know what the actual numbers are. It's important to be working on that. But I also feel like, we're working on that, but also need to be tapping into our partnerships and to those local people, because that kind of, I don't want to say mob mentality, but once you get enough people involved and enough people talking about this, think your local PTA and parents that really care, that's when you kind of drive those things together of getting the policy and getting the people together to do that. And I guess I'll stop there. There's so much more that kind of I want to say now that we're like in the mix of it, but we're really doing both things at both ends. That grassroots is so important, and it educates people to understand. And then just the last thing, I've found that for drowning prevention, when I go and talk to people about drowning, they step back. But when I go to talk to people about water safety, and I think Acacia said something as well about health aspect, it feels really important, as we all go out and speak to people and get this, that it's about the health of our children. It's about keeping us, it's like as soon as you talk about the deaths and the people don't think that it's going to happen to them. My kid isn't going to touch a gun. My kid isn't going to drown. But, attempting to go in a positive communication style has at least been effective for me. So thank you.
Thanks so much, Jacek. And Acacia, I'm sorry if anyone of whose name I've mispronounced, I apologize. But a really important point that we have talked about throughout this is how you not only mobilize people, but how you your words and how you bring those words to the awareness and to the action so that everybody understands right across the board. And I think that the difference between drowning and talking about water safety is really an important point and a point of engagement for many people here. So thank you. Thank you so much. I know we've got a video to show, but I just want to touch back to Shannon for a second and say, I don't know if you have, outside of what I've talked about, the Gun Shop Project, can point to any stories, promoting safe storage, particular stories. I think Ethan's Law that's come out of Connecticut and is in some other states is a safe storage law. Do you have any particular resources to point folks to different gun, firearm prevention, gun safety stories?
Sure. Yeah. Dana makes a really good point. So there's lots of different ways to store a gun. And if you have multiple guns, you need to consider that too. So especially if you needed to temporarily remove guns from a home because there was maybe a situation where you just needed to get them out of the home, look at law enforcement. They can potentially temporarily hold guns. Also, gun ranges in your state or stores that sell firearms can also store weapons for you. And I would say also we have, volunteers nationwide that are really pursuing legislation at the state level to try to convince states to have like a tax-free day on firearm storage. So look and see if your state is pursuing that or has it already, because I know for like you're talking about for like a large safe to hold multiple guns, those can get expensive. And so if there was a tax-free holiday where you could go out one day and buy something and not have any sales tax, I think that'd be a great incentive to get people out to buy more storage. But definitely look online. And I will say that storage prices are coming down on Amazon. We're getting the small boxes that are handgun size, and those prices have dropped almost half in the last few years.
Great. Thanks so much, Shannon. So folks can learn more about this through Be Smart, like the tax safe holiday that you just brought up. Would that be a place?
No, they would need to really look at each individual state's laws, but to learn more about different ways to store weapons, there's many different storage solutions. You can go to besmartforkids.org.
Okay, perfect. Thank you so much. So 50 states, 50 different resources, potentially some of them are the same, but you can learn more about that. Sharon, I know you've got your hand up. We've got to get to our closing video, but quickly, I think let's talk to Sharon and Safe States.
Yes.
I just wanted to underscore what Jenna brought up is really understanding that, again, the data are going to tell us what we need to do, right? So what you're experiencing in Iowa with firearm violence is going to be different than what you're experiencing in downtown Chicago. It's going to be different than what you're experiencing in Alaska. You're using firearms for hunting. We know that on the frontier states, suicides are actually more of the concern, deaths by suicide versus, urban homicides. And so understanding what the unique characteristics are of your state and then developing your policies based on that and your practices are really, really important. I just wanted to underscore that. Thanks for the time.
No, thank you so much, Sharon Gilmartin, for sharing that perspective. And Jenna did put that in the difference between, rural and urban settings. And, I talked a little bit about it with Justin and, thinking about he's in a much more urban setting. And I was just in Chicago, totally different than, West Lebanon, New Hampshire. We have some of the same issues, but how we approach those issues is going to be a different style to get the work done. So I'm going to turn it over to Delaney, but I want to thank all of you, not just for joining us here today, but for our panelists for sharing your stories and your expertise so that we can work with you and you can unify your voices and you can take the awareness from today and your work every day and your passion, and you can bring it to action to make change for safer communities, safer children, safer families. Thank you so much. Delaney, take it away.
Thank you, everybody, for being here today. All questions that remain unanswered will be answered by email. I will look you up and make sure that everybody gets their answers to their questions on the Q&A. We apologize for going over on time, but we just want to encourage everyone to hashtag Be Injury Free, be part of National Injury Prevention Day, November 18th. But don't stop there. Every day, as we have heard, is an opportunity to do injury prevention and to be smart about the way we make decisions on a daily basis, the way that we work with our legislators to inform them and change policies to increase support for the work that we do is incredibly important for funding, for program development, for research. As somebody mentioned, a lot of our resources for research and data are being dismantled at the moment, but there are resources out there. So if you have questions, please reach out to info@injuryfree.org and we will make sure to find the resources that you need. Again, thank you for being here today. We'll leave you with a 1-minute video just so that remind you why we do this work. Walter.
Thanks. Thanks, everyone.
Injuries happen every day, suddenly and often without warning.
Injuries are the leading cause of death for Americans ages 1 to 44.
But death is only part of the story.
For every life lost, many more are changed forever.
Injuries leave lasting scars on bodies, on families, and on entire communities.
Many of these tragedies can be easily prevented.
That's why we come together on National Injury Prevention Day.
On November 18th, communities across the country unite
to share knowledge, resources, and hope.
Make our homes, roads, and neighborhoods safer.
Our mission is simple.
Prevent injuries and save lives through education, advocacy, and collaboration.
We empower people to act before tragedy strikes.
Join us and raise awareness.
Promote proven strategies.
Empower communities.
Advocate for prevention.
And share what you know with the people you love, with your community, and through social media using hashtag #BeInjuryFree.
Partner, advocate, and educate.
Together, we can prevent injuries, save lives, and build a safer future for all.
Be injury free.
Thank you, everybody. Be safe, be well, and come back. Have a great day.